Hello and welcome to today's webinar, In the Midst of Plenty, Homelessness and What to Do About It. My name is Sarah Mancall and I'm the Policy Director for SPSSI, the Society for the Psychological Study of Social Issues. We are also known as Division 9 in the broader APA community. A few quick logistical points as we get started today. On the screen, you should see and be able to hear from all of our panelists. Since this is Zoom webinar, all attendees are in listen and view only mode, but that said, we would love to hear from you today. So as attendees, please feel free to use the chat function to send us your questions. We're going to have a ton of time for questions today. And please also use the chat function to let me know if you're having any technical difficulties, and I'll try to troubleshoot. I would also like to mention that today's webinar is being recorded and I'll be posting it afterward to SPSSI's YouTube channel. Please note that only the speaker's video and audio feeds will be shared afterward. All of the questions and comments in the chat box will just be kept here. It will not be shared afterward. Our speakers today are the authors of a new book recently published as part of SPSSI's Contemporary Social Issues series entitled In the Midst of Plenty, Homelessness and What to Do About It. I actually have a copy right here, and that's also the book cover that you see on your screen. If you're interested in purchasing the book, I'll be sending a link around afterwards so that you will have a link and you can go directly to Wiley's website and purchase the book. And now on to the introductions for our two speakers. The two speakers are the authors of the book. Dr. Marybeth Shinn is the Cornelius Vanderbilt Professor at Vanderbilt University. She co-led the family options study of different approaches to ending family homelessness, evaluated the initial study of the Pathways Housing First experiment, and developed a model used by New York City to target its homelessness prevention services. Dr. Jill Khadduri is a principal associate and senior fellow at Abt Associates. She co-leads the annual homelessness assessment report, has played leading roles in several important studies of both homelessness and housing policy for 2 decades, and served as director of the Policy Development Division of the Department of Housing and Urban Development. Thank you both for attending today, and I look forward to hearing from you.
Okay. So take it away, Jill.
Thanks for hosting us, Sarah, and thank you to all the people who have joined us today. Our book is organized around 4 questions. Who becomes homeless? What causes homelessness? How do we end homelessness? And how do we prevent homelessness? So the first question, who becomes homeless? More than 500,000 people are staying in shelters or found on the street on a single night. As of January 2019, it was about 570,000, and the number went up somewhat in January 2020. And we know that we miss people, since it's hard to find people in hidden locations and count them. In addition, many more people experience homelessness over longer periods. More than 3 times that many people stay in shelters at some point during a year's time. Back in 1990, early in the current epidemic of homelessness, a telephone survey of people living in regular housing units, not in homeless shelters, not in jails, not in barracks, found that 7% of adults said that they had been literally homeless at some point in their lives, and twice that many if we count people who were doubled up in other people's housing. So most homelessness is a temporary state that people pass through. And that gives us many points of intervention. How do we prevent homelessness? How do we help people escape homelessness? And how do we stop generating more homelessness? So on a single night, there are roughly equal numbers of individuals who are sheltered, individuals who are unsheltered, and families. Individuals are people who don't have a child with them during the time they're experiencing homelessness. Thankfully, most of the children are in shelters and not on the street, as you can see by the very thin slice of the pie.
So Jill, you have frozen. let me keep going until Jill gets back. So infancy is the age at which an American is most likely to stay. Okay, you're back, Jill.
Okay, so infancy is the age at which an American is most likely to stay in a homeless shelter. And rates of homelessness stay high in the preschool years and then drop when children reach school age and families are more likely to be able to find someplace else for them to stay. Then homelessness rises again, and rates of homelessness rise again in adulthood. And as you can see, there are not many people in their 60s or older who are currently homeless. But that number has been rising in recent years, and it will continue to rise. Older adults experiencing homelessness face severe health challenges, even when they're just in their 60s. So when we think about the face of homelessness in America, we should think not just about the man on the left, but also about the child on the right. So what caused the current epidemic of homelessness, in which more than 500,000 people are homeless on a single night? And why are some people particularly vulnerable to becoming homeless? We have three powerful pieces of evidence that what caused the current epidemic of homelessness is a housing affordability crisis. What I mean by the current epidemic is the homelessness that began to be apparent in the early 1980s and continues today. One piece of evidence comes from history. What was going on when the current epidemic of homelessness started? Another piece of evidence is from geography, where rates of homelessness in the US are the highest. And the third piece of evidence is from what we know prevents homelessness. This slide shows that in 1970, there was a small surplus in the number of housing units that people at the bottom of the income distribution could afford, by the standard that households should spend no more than 30% of their income on rent. And at that point, we had very little homelessness. Indeed, in the 1960s, social scientists thought that homelessness was at an end. It was largely confined to older men in skid rows. One book at the time was actually entitled Old Men Drunk and Sober. And researchers thought that when that generation passed away, so would homelessness. But indeed, that's not what happened. Following World War II, many poor quality units were replaced by better housing that had indoor plumbing and that was built to code standards. The cost of maintaining better housing was higher, so the lowest rents on available units went up. But at the same time, income inequality grew, and incomes at the bottom of the distribution did not keep up with the cost of housing. Poverty was already high in the United States compared to other industrialized countries, and particularly so for families, and poverty became deeper. More people were living at half the poverty level. Thus, that surplus of affordable units turned into a deficit, and the deficit grew larger over time. Over the 1980s and 90s, people began to spend more and more of their income on rent, and when that couldn't last, they doubled up with families and friends. And then when those arrangements broke down, they took to shelters in the streets. So modern homelessness arose, first among younger men and then among families. This map shows that what an earner's hourly wage would have to be in order to afford the fair market rent. That is, rent at about the middle of the market. There isn't any state where a family with one full-time minimum wage earner would be able to afford the rent. In some states, the situation is worse, those states that are in darker blue here. The figure illustrates the relationship between housing costs and high rates of homelessness. It shows the largest 25 metro areas in the US. The left axis is the rate of homelessness, the point in time count of people experiencing homelessness divided by the total population. The bottom axis is median rents. You can see a clear relationship here. Homelessness is higher in places with particularly high rents. Those metro areas, New York, Boston, San Diego, San Francisco, are affluent in some ways, but there's also a lot of income inequality and therefore many people who can't afford the high rents. And these are the places that really have high rates of homelessness. This is the final piece of evidence that homelessness is fundamentally a housing affordability crisis. A rigorous study, a study that both Beth and I were involved in, of the effects of providing housing vouchers to families with children shows that having a voucher wipes out the risk of homelessness. Now I'll turn to Beth, who will talk about why some groups are particularly vulnerable to homelessness.
So among those living in poverty, why are some groups particularly vulnerable? In the book, we discuss this at length, with particular emphasis on the role of racism and social exclusion, manifested in incomes, wealth, housing, and incarceration. The first form of discrimination is in jobs and incomes. In 2018, Black men earned about 3/4 as much as whites. Black women earned about 4/5 as much as whites. For the past 3 decades, unemployment has been roughly twice as high for African Americans than for whites. This is not a difference in skills and experience. A paired testing study had people with the same education and experience answer job ads, but using names identifiable as African American or not. The study measured differences by the person's apparent race in being called for an interview. The difference between being Lakeisha and being Emily was the equivalent of an 8-year difference in experience. Wealth disparities are much starker than income disparities. The median white family has 13 times the assets of the median Black family. And even a Black household with a college degree has less wealth on average than a white household with less than a high school diploma. Because for poor people, most wealth is tied up in housing, Black families are more likely than white families to experience housing crises, and they're less likely to have a relative or a friend able to provide housing resources. These wealth disparities didn't just happen. They resulted from a long history of governmental as well as private discrimination. Sorry. Excuse me. So the federal government segregated public housing, with Black families shunted to inferior housing projects. The Federal Housing Administration refused to insure loans to Black homebuyers, or even whites in integrated areas where Blacks also lived. The color-coded maps used by the Federal Housing Administration to deny loans in so-called risky areas are the origin of the term redlining. Thus, Black families were unable to benefit from the accumulation of housing wealth following World War II that white families were able to pass on from generation to generation. Urban renewal often cleared out neighborhoods where Blacks lived, and highways cut through Black neighborhoods or cut them off from areas with better jobs. And paired tests that measure housing discrimination by sending similarly situated Black and white renters or buyers to the same housing units show that it continues, despite the fact that it's been illegal since the late 1960s. And then there's the disparities in rates of incarceration that were exacerbated by the so-called war on drugs, and the much greater likelihood that people of color would be incarcerated as a result of minor drug charges. Incarceration takes fathers out of families and earners out of communities. Incomes are affected even after a person is released. People with disabilities have not just the challenges associated with their disabling conditions, but also face discrimination in the housing and job markets. And income benefits for people with disabilities are too low to afford housing. So those are the causes of homelessness: a housing affordability crisis that's particularly hard to cope with for people facing social exclusion. Now let's talk about solutions. What we know works for resolving homelessness and preventing it. Here we have evidence about programs that end homelessness for particular groups, and also about the impact of broader systems change. The Family Options Study compared different interventions for families recruited in homeless shelters. It showed that offering families housing vouchers that reduced rental costs to 30% of their income not only ended homelessness and other forms of residential instability, but it also had radiating impacts. It reduced separations of children from parents, children's school absenteeism and behavior problems. It reduced families' food insecurity. For adults, it reduced domestic violence, psychological distress, and substance abuse. That is, vouchers provided a platform for families to solve other problems on their own. As one mom put it, for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full time, and so am I. We know we're supported, and we don't have to worry about losing the house, because we're trying to go to school and work, and we're safe, we're okay, and we'll get things back on track. Further, few families were ineligible for the vouchers, lease-up rates were high, and all those benefits cost only about 9% more than usual care in the communities that we studied. Vouchers alone end homelessness for most families. People with disabilities often need more. Supportive housing, subsidized housing with services that are under people's control, ends homelessness for people with serious mental illnesses and substance abuse problems. The traditional approach here is sometimes called the staircase model, in which people earn their way to more independent housing by addressing behavioral health challenges. The housing first approach bypasses the steps in the staircase model and gives consumers immediate access to independent, permanent housing without preconditions and with services that they choose. There's strong experimental evidence that this approach works better than the old staircase model. It ends homelessness without exacerbating substance use because services work better when people choose them freely. In addition to describing the specific programs, our book discusses the more general homeless service system and efforts like coordinated entry to make it more efficient and effective. When we make coordinated efforts and put resources behind them, there's evidence that we can end homelessness. We cut veteran homelessness nearly in half with the combined efforts of the Veterans Administration, HUD, and state and local governments. And we reduced chronic homelessness by increasing the supply and targeting of permanent supportive housing. Finland has largely ended literal homelessness with a concerted housing first approach. Note that the light blue bars here, institutional placements, would not even be counted in the US figures. The evidence is strong that we can end homelessness for people who experience it. But we also need to prevent homelessness for people on the brink and to stop generating homelessness. Prevention programs are difficult to target well because it's hard to tell who would have become homeless in the absence of the program. It's not enough for a provider to say, 90% of the people who got my program remained housed. I can tell you how to get to 100%. Just give your services to millionaires. So bad targeting can masquerade as effective prevention programming. Every study that has looked finds that you get the most impact by focusing on the people with the highest needs, even if you also have more failures there. We have strong evidence that a few prevention strategies work. As Jill noted earlier, there's experimental evidence that the same housing vouchers that end homelessness also prevent it for poor families. There's evidence from multiple studies that New York City's home-based program, essentially good old-fashioned social work backed up by some cash resources, works for both individuals and families. And although most people who get evicted do not go on to become homeless, there's good experimental evidence that cash help can reduce that number much further. There's weaker evidence for some additional approaches. Legal help reduces evictions, but we don't know that it also reduces homelessness. Ongoing rental subsidies that are more modest than those provided by housing choice vouchers prevented homelessness among people with HIV in one study. And universal screening for prevention was part of the full court press that reduced homelessness for veterans. Now Jill will talk about some broader strategies.
Thanks, Beth. I'm now going to talk about prevention in a broader sense, as Beth said, and that's the final chapter of our book. There are three ways that we can do this. We can do that by reducing housing costs, increasing incomes, and combating social exclusion. The most powerful single thing that we can do is to expand the Housing Choice Voucher Program. That program, sometimes known as the Section 8 Housing Voucher Program, pays a landlord the difference between a housing unit's rent and no more than 30% of the family or individual's income. The program has existed since the 1970s, but has expanded only slightly over the past 20 years, from 2 million to 2.2 million households. There is now finally talk about a universal voucher program, which is great. Housing vouchers prevent homelessness, and they work just as well for Black people and other people of color as they do for white people. Now, a universal program does not mean a program for all US households. We would keep the current income limit, which varies across the country, but is roughly the equivalent of the poverty line. Getting to a program that's available to all poor renters would require a phase-up, maybe adding 300,000 units a year to the current voucher program. Adding vouchers at that pace would make the public housing authorities that run the voucher program more willing to set aside vouchers for people experiencing homelessness. And adding vouchers at that pace would go far towards stopping the inflow of people into homelessness. Some areas of the country also need to work on expanding the supply of rental housing. That could be done by expanding the programs that build affordable housing with subsidies. I particularly like the new program, relatively new program, called the National Housing Trust, because it is targeted heavily to the states that actually have supply shortages, and affordable housing is hard to find there, even with a rent subsidy. An equally important, perhaps even more important way of increasing supply is by overturning exclusionary zoning. For example, reducing barriers to producing multifamily housing in neighborhoods and even entire jurisdictions, and reducing barriers to subdividing existing housing units in order to produce more housing units. The housing affordability gap can also be closed by helping people increase their incomes, strengthening the income side of the safety net. For example, evidence shows that there's plenty of room to raise the minimum wage without a negative effect on the supply of jobs. The earned income tax credit works well for those who are able to work and could be made more generous. More widely available low-cost childcare would reduce a major barrier to working for families at risk of homelessness. And for people unable to work because of their disabilities, SSI and SSDI income support could be raised to levels that make housing affordable, or at least to levels that require only a small rent subsidy to make housing affordable. An expanded housing choice voucher program would go a long way towards preventing homelessness, but we also need to work directly on social exclusion. Some states and cities have what's known as source of income laws, laws that prohibit a landlord from refusing to rent to a household just because the household will be using a voucher to pay part of the rent. We have evidence that vouchers work better in places that have those laws. A higher percentage of people can use their vouchers. People who need to move out of their current situation to use a voucher are more likely to succeed in finding a new unit and renting it. It would be good to have a national source of income law that applies everywhere, in addition to those modest numbers of states and communities that already have such laws. And we also need better enforcement of the national fair housing laws that are already on the books, outlawing discrimination on the basis of race, ethnicity, and disability. So we know how to end homelessness. We know what causes it. We know how to help people leave it. And we know how to prevent it. What it's going to take is political will.
Okay. So we look forward to your questions.
Great, and we actually have a number of questions. So I'm gonna start with some of our questions. And if people attending have more questions, please send them to us and we'll get to as many as we can. So the first question I have for you both is, what specific challenges or opportunities differentially affect the ability of smaller towns and smaller cities to disrupt homelessness compared to larger cities? And how can they work to address these different challenges?
Well, homelessness is higher in more heavily urbanized areas. It's particularly high in the 50 largest cities in the United States. About a little more than half of all the homelessness in the United States is in those 50 largest cities and their metropolitan areas. But that doesn't mean that there isn't a lot of homelessness in other areas as well. The good news is that outside of those major metropolitan areas, housing costs are lower. And that means that housing vouchers are really the solution in smaller communities because it's just easier in those places for somebody, as long as they have the ability to pay the rent, to actually, find an available unit to rent.
Mm-hmm. There's certainly differences in place to place in the extent to which the problem is essentially housing affordability, and there are vacant units that are available if people can afford them, and in places where there's a real shortage of housing at any level. Those latter areas tend to be the big coastal cities, San Francisco or New York, rather than much of the rest of the country. But there is local variation, and people need to plan around the particular resources that they have, as well as the particular situation that faces them.
And now for our next question. This is from someone who's going to graduate with a Bachelor of Social Work in April. Congratulations, by the way. How do you think social workers serving homeless individuals can better support them? And do you believe social workers have any real power to advocate for homeless people in legislation? Furthermore, do you believe there are added barriers to housing for people with serious mental illness? And if there are, what are they?
Well, let me start with the last one first. There are barriers to housing for folks with serious mental illnesses and also some other disabilities. There's housing discrimination against them, the same kinds of paired testing that shows housing discrimination against folks with of color shows housing discrimination against folks with disabilities. And disability incomes are not enough to afford even a studio apartment any place in the country. So there are those barriers, and folks with serious mental illness probably need some additional services along with affordable housing. So the Housing First model we talked about provides wraparound services provided by an assertive community treatment team, not just mental health services, but vocational services and recreation and connecting people to community. And there's really good experimental evidence that it works well. Going back to the first part of your question, and again, congratulations for graduating. I think we need to understand, I'm a psychologist by training. SPSSI is the Society for the Psychological Study of Social Issues. Homelessness is not really a psychological problem. It's a problem of affordable housing and of discrimination. And so one thing that we can do and that social workers can do is kind of recognize the broader forces that are at play in their communities and not assume that sort of counseling kinds of services are going to make an enormous difference. But social workers are great at connecting people with resources that are there, making sure that people have access to the resources that they're entitled to. Most people who are eligible for TANF in this country, that's temporary aid to needy families, the current version of welfare, aren't getting it. So hooking people up to the resources that they're entitled to and advocating for people and saying, this is what the limits are of what I can do. Folks have to come in with affordable housing.
Well, let me mention a couple of specific things that a social worker can do, a couple of specific roles. One is really difficult, and that's outreach. Outreach to people who are on the street. To make a connection with them, it often takes time. It usually takes time, and to persuade them that there is an alternative to being on the street. That kind of outreach usually works better if the outreach worker can say, we're really going to be able to connect you with housing. Than if that's not the case. But that is such an important function of people doing social work. Another one is case management that relates to both finding a unit to live in, with a voucher, without a voucher, but finding a unit and then, providing support for the family or the individual during the period when they get stabilized in the housing. What we have found repeatedly is that landlords are much more willing to rent to somebody if there's a caseworker involved, if there's somebody, if there's just a number to call, if they know they'll be able to call in the event, and it's actually a pretty unlikely event, that they'll start having tenancy problems with the tenant. So those are my ideas of a couple of very specific jobs that a social worker could take that are important for ending homelessness.
I'll also add, as SPSSI's policy director, I have a few ideas for how someone in the social work community could get involved. One is to really turn to your professional associations. The National Association for Social Work does a ton of national policy work. APA and other organizations like it have a big footprint in Washington and work a lot at the federal level on policy issues. Also, following the work of national coalitions. One example is the National Alliance to End Homelessness. There are other major national coalitions doing a lot of work that you can get involved with. And finally, there are groups that are training people in the scholarly communities, including in the social sciences, on how to get involved in policy at the local and state level. One example is engaging scientists and engineers in policy. It's called ESEP. I believe it's run by AAAS, the American Association for the Advancement of Science, but they do a whole series of trainings that are really wonderful, talking about how you can get involved in state and local policy, sitting on councils, running for your local council, serving on a local advisory board. So there are many ways to be an advocate in many different areas of policy, in social work, in psychology, and in other areas.
Mm-hmm. That's super. And the National Association of Social Workers has actually taken homelessness as one of its grand challenges that it's working on, and has produced a document about homelessness and what to do about it from the social work perspective.
I have another question for you both. What do those with serious mental illnesses initially have to do in the staircase model that you referenced earlier?
First, you have to be clean and sober before you're even allowed to come indoors. And so in the initial study of the Pathways to Housing First program in New York, we found that programs tend to sort people more than they tend to help people. That is, if you looked from random assignment, people who got into programs that required you to be clean and sober versus, or who were assigned to those programs versus assigned to the Housing First programs, from random assignment, they didn't look different. People who got indoors in the Services First programs, the ones that required you to be clean and sober first, were more likely to attain sobriety, but those who didn't were left out on the street. And so the programs were really sorting people into those that were willing to kind of toe the line and those that weren't, with the penalty for not being able to shake a substance abuse problem being homelessness. And so the Housing First approach says, get people into housing first. That's the platform with which they can begin to address other problems. And it also takes a harm reduction approach. It says, how is your problem affecting your goals? And to the extent that the problem is affecting your goals, then you're motivated to do something about it. But the first barrier is sobriety. And if sobriety fails, then people get bounced back to the lowest step on the ladder again.
I have a question for you about nimbyism. So a huge barrier seems to be overcoming NIMBY, not in my backyard sentiments, on local city councils and in state legislatures. How do you think we can best expand and support YIMBY? Yes, in my backyard sentiments and views, as well as action. And what do we need to know as psychologists to understand and change current attitudes?
Well, NIMBYism is more of a problem for programs than it is for something like the Housing Choice Voucher program. that is for congregate programs where people are all in one place. If you're going to build a new facility for folks experiencing homelessness on a particular city block, that can often lead to various kinds of political opposition. But if you give people housing choice vouchers to go and get housing in any neighborhood in the city, that doesn't arouse the same kind of opposition. So one thing we can do to reduce opposition is to reduce congregate programs. But NIMBYism is real. And Finland has done a pretty good job of trying to reduce it, as have many communities in the United States, but the Finns actually wrote about it. And so one thing they do is they invite people from the local community into the facility. They often have people in the program doing volunteer work in the community. If you see folks from a local shelter being crossing guards for children and cleaning up parks and the like, then opposition tends to evaporate.
So, I mean, Beth is completely correct that one of the advantages of housing vouchers over other ways of providing affordable housing to people is that it does not run into NIMBYism, and vouchers in fact do a better job of making it possible for people to live in a variety of different neighborhoods. On the other hand, it still is the case that there are a lot of places that don't have they don't have housing that can be reached with a housing voucher. I mean, there are neighborhoods that have zoning restrictions. There are entire communities that don't permit multifamily housing. And it's very important to work on overturning those barriers. Those are not explicit barriers against people who have experienced homelessness or have obvious challenges, but overcoming those barriers more generally to more dense housing. And another way of doing it that I alluded to is removing the restrictions that say that if you have a 3-story house, you can't divide it into apartments, because that's another way, a traditional way of providing more relatively modest rent housing, but it's a way that increasingly has been restricted. And so, you know, a lot of places are working on that. A lot of places, there are states, there are cities that are working on overturning those exclusionary zoning laws, but it's tough, and it takes, you know, it takes voices, it takes advocacy at the local level, it takes letting your city council know that you want to see more affordable housing, and that you'd like to see that kind of restrictive exclusionary zoning overturned.
The next question I have for you is, while waiting for resources to expand, what role should racial equity play in prioritization tools and processes to address existing inequalities?
Mm-hmm. Well, there are lots of roles there. One is in kind of national policy, and another is with local homeless service systems. So in national policy, as Jill said, we need source of income discrimination legislation. It is legislation that prohibits a landlord from denying somebody the right to rent on the basis of the fact that their rent is going to be partially paid with a housing voucher, because that often masquerades for racial discrimination, or hides racial discrimination. So getting that kind of legislation is important. A second is the affirmatively furthering fair housing regulation. So 50 years after the Civil Rights Act said that communities were required to affirmatively further fair housing, it's a bit of a mouthful, HUD finally created the regulations behind that required communities to assess what they were doing and what the barriers to fair housing were, and to figure out how to overcome them in order to be eligible for HUD funds. And then the new administration promptly put a halt to those. so that we can go back to those processes, and communities that are required to think carefully about furthering fair housing, have often done so in very thoughtful ways until the requirement was totally lifted. So those are things that broad policy can do. We also need to think about homeless service systems and the extent to which the ways that they set priorities for services may discriminate against people of color. And service systems need to reflect on their own data on whether they are being equitable for folks from different races and ethnicities. They need to think about the workforces that are working with people who experience homelessness and think about racial equity there. And so at every level, we need to be thinking about racial equity and working to try to attain it seems quite a goal, but at least to reduce the inequities that pervade our system.
And as far as possible inequities, unintentional often in the homeless services system, I'd like to reinforce the point about look at your data. I mean, every community continuum of care, which is the local planning agency that basically runs the homeless services system, has a great deal of data. Those data systems, they're called homeless management information systems. They've grown up over the last 15 years. And that data is available for a community to use to assess whether people of color are in fact getting access to the homeless services system in the same, to the same extent that they are represented and usually very heavily overrepresented among people who experience homelessness. So look at the data, use the data, encourage your communities to do that.
The next question I have is, what do you think about the strategy of declaring homelessness a public health crisis? This has helped in some places in California where housing shortage is driving those long-term homelessness.
Mm-hmm. So one thing we've seen in the COVID crisis is that there's some communities that have considered the COVID crisis as a public health, well, everybody considers it a public health crisis, but one that differentially affects people experiencing homelessness, and has put folks into hotels instead of into congregate shelters so that they're less likely to contract COVID as a part of participating in the homeless service system. That makes a lot of sense, particularly if that can be then used as a bridge to permanent housing. So use CARES Act's funds to give people temporary housing subsidies that can bridge to the permanent housing subsidies when their names come up on the waiting list. Being clever about it can allow somebody to get from street to hotel room to permanent housing with the funding sources kind of changing along the way.
And one of the advantages of the, a formal declaration that homelessness is a public health crisis is that it helps encourage health systems to do their job as part of getting people out of homelessness. As Beth discussed earlier, it's not as though people with serious mental illness or other disabilities don't need services. They do need services. And in order to provide the kind of supportive housing that helps people get out of homelessness, those services need to be available. And so in places where the public health system is really willing to come to the table and is in, and recognizes their interest in coming to the table, because successfully housing people really lowers the numbers of people who are found in emergency rooms and in inpatient situations, and ultimately leads to cost savings.
I have another question for you both, and this is having to do with mixed income housing. What do the panelists think about the merits of mixed income housing, which offer fewer lower income units compared to building units that are earmarked exclusively for low income housing?
Mm-hmm. Well, I don't, I'm not a great fan of mixed income housing. It usually doesn't provide very many units for the people who really need the housing the most. It tends to divert resources away from people who are actually in poverty and at risk of becoming homeless. The best way actually to mix incomes is to provide tenant-based vouchers so that people can go out in the community and rent regular private market housing, which is not exclusively for poor people.
Mm-hmm. And HUD is experimenting with local area fair market rents. That is, HUD will subsidize rents up to what's known as the fair market rent, which is a modest rent. It's set at the 40th percentile of new units coming on the market in a metropolitan area. But that means that the housing is quite affordable at the fair market rent in poor areas and totally unattainable in wealthier areas. And local area fair market rents say, let's change the rent standard that HUD will pay to in areas that are wealthier versus areas that are poorer. So that's another way to get more income mixing.
And my company, Abt Associates, recently completed a study of small area fair market rents and found that in fact they work. They do what they're intended to do in terms of making more housing available in better neighborhoods. And they do it and you know, as far as we can tell, this is pretty much cost neutral because you know, some of the rents will be higher, but then some of the rents in other parts of the area will be lower. So currently small area fair market rents are only required in a certain number of metropolitan areas. I really hope that small area fair market rents will be implemented throughout the country in all metropolitan areas. And I think that there's some chance that that will happen in the near future.
Mm-hmm.
My next question for you is, could you speak a little bit more about what some of the major differences are between homelessness in the US and homelessness in other contexts, such as in Europe? Thank you.
Well, the US is the leader, as in incarceration, or the leader in homelessness. It arose earlier, modern homelessness in the United States, and I think it's more severe here. It's rising in Europe. Ireland is having a problem, Australia, Canada, so other places around the world are experiencing increasing homelessness. What's interesting in Europe is that there's a international kind of consortium where people get together. It's called FAANSA. Don't ask me what the acronym stands for. And people from each country can find something that another country is doing better than they are. And then they can go and advocate for that in their own national context. And so they've been ratcheting up some of the standards in Europe. Europe has really embraced housing first. Finland, as we said earlier, has largely ended literal homelessness. But Europe's struggling as we are with homelessness. Canada has really provided a lot of evidence that housing first worked. For a long time, there was just this one small study in New York. Canada did this massive 5-city at-home chez soi study that really proved that the model works with high fidelity, and has made it the Canadian federal housing policy to follow that model. Whereas our own current head of the Interagency Council on Homelessness is kind of moving us back towards congregate shelters. So I think the problem is a little worse in the United States, and we can learn from our European counterparts at the same time that they've learned by adopting things like Housing First that were originally developed in our country.
And if you both have any time for a few more questions, I have a few more. And if anyone else on the call has additional questions, please send them along. One question, you published your book recently, but I take it the book was written pre-COVID. So can you talk a little bit about how COVID is affecting policy related to homelessness?
Mm-hmm. You want to start?
Well, I mean, we don't really, we don't know yet, other than in an anecdotal way, how the COVID crisis has affected homelessness. We'll do a new point in time count in January 2021, and we'll probably find that rates of homelessness have gone up overall. Probably street homelessness will have gone up. A lot of people, as Beth was mentioning earlier, have been brought into hotels and motels, but those numbers are really not adequate. And one of the reasons for bringing people into motels is that bringing them into more congregate shelters and making those shelters more dense is obviously not a good idea in the middle of a health crisis. So we think one of the things that we're almost certain will happen when we see, what homelessness looks like once we're through the pandemic, is that the racial and ethnic disparities in homelessness are going to be even more severe because of the impact that job loss and income loss has had on communities of color. And that's going to take a long time to get over. And so we're probably going to, find that post-COVID, we have even higher rates of homelessness than we've had before, and that the disparate effect of homelessness on people of color is going to be even greater than it already is.
Mm-hmm. And we'll probably see that impact, as Jill said, largely on unsheltered homelessness. That is, people are more reluctant, reasonably, to come into congregate shelters in the course of a pandemic. And in places like Nashville, where I live, the volunteer sheltering capacity of churches that do winter shelters is very much cut down. There's churches don't want to welcome people into their basements anymore to put them up for the night. And so, I mean, some churches are still managing to do that, but the capacity for shelters, particularly the winter sheltering programs that are more informal, may be going down. But it's likely to take a while for us to see all of it. Homelessness is often said to be a lagging indicator. That is, the first thing people do is they fall behind on their rent. And if the eviction moratorium is not extended by the CDC, more people will get evicted. But when people get evicted, they don't run down to the local homeless shelter or take to the street. They move in with other people if they can, and which can also exacerbate COVID. And it's kind of only down the line that we see the increase in homelessness. But it could be severe. Depends a lot on what we do in terms of getting relief to people.
And one final question. We just had a presidential election in our country. What do you see potentially happening with regard to homelessness policy as we welcome in a new executive branch leadership?
Well, I think Beth alluded to one of those changes already. Well, she alluded to more than one of those changes. One is that under the current administration, the Interagency Council on Homelessness has tried to back away from the Housing First philosophy. That will clearly change. I mean, we'll go back to having national policy really encouraging a Housing First approach. Another thing is the reinstatement of the affirmatively furthering fair housing regulations. I'd like to see them even stronger than the regulation that was issued by the Obama administration. And then finally, the Biden-Harris campaign is on record as being favorably inclined towards a universal housing voucher program. Whether an open enrollment program, that is to say, a program in which anybody who has a poverty level income is eligible to get a voucher and try to use it, that may be implausible in the near future, but I don't think it's implausible that we could go back to adding a couple 100,000 vouchers a year to the housing voucher program as it currently exists. There's absolutely no reason why that can't be done and why there's not room for it in the federal budget.
Mm-hmm. Yeah. And more broadly, I mean, those are the very specific policies which would be great to see enacted. But since homelessness is caused by housing unaffordability, anything that lowers rents, like a housing choice voucher program or an expanded national housing trust fund, or raises incomes at the bottom, which could include a more generous earned income tax credit. We're seeing minimum wage laws passed around the country, even in conservative jurisdictions. Anything that lowers housing costs or raises incomes reduces that gap and will reduce homelessness. And so there are a great variety of programs. You know, expanding Medicaid reduces income volatility, since health expenses are one source of income volatility. Expanding childcare could help more young parents into the labor force. So there are a variety of things that could help, and I'm hopeful that we'll see some of those.
And what I'm hoping does not happen is that we just rely on short-term financial support to help people avoid being evicted, and forget about the fact that we have not a permanent, because of course we hope it's not permanent, but we have a more underlying affordable housing crisis that is going to take longer term housing subsidies that a family can use for a few years in order to reduce homelessness and prevent it from and prevent the inflow into homelessness.
Which is not an argument against short-term help. It's an argument.
Not at all.
Not at all.
Not enough.
Mm-hmm.
Well, thank you both so much for your contributions, for your book. I'm gonna give it one last plug for everyone. Go out and buy it. What I will do is after this webinar, once it has been saved in the cloud, I will upload it to YouTube and send everyone who's attending today, everyone who registered to attend, and SPSSI members more broadly, the link. I'll send you the link to the book. And I also had someone ask if we could send information on how they can look up their own local homelessness data. You had mentioned earlier that people can actually look to see what disparities there are in their own communities. And so maybe Dr. Shinn and Khadduri, if I could talk with you afterward, you can share some information that I can share with the group as well. We do have one more question that just came in. So this will be our final question today. In my state, vouchers have been almost exclusively used for HCV and similar style vouchers that, as you mentioned, are very useful in helping to keep folks from falling into homelessness. Meanwhile, we have a desperate need for project-based vouchers targeted for PSH. Any thoughts about the tension between the uses for these voucher resources?
So PSH is permanent supportive housing. And it can be provided in scatter site places with vouchers with the services. So the trick on permanent supportive housing is not so much trying to get it into projects as to try to fund the services that combined with the housing create the resources. You were about to say something, Jill.
I was about to say the same thing.
Well, thank you so much. Thank you again to everyone. And I will be following up with information. So have a great rest of the day and an easy early Thanksgiving, everyone.
And thanks for listening.
Thank you, Sarah.
Really appreciate it. And thank you, Sarah.
Bye.